This is Chicago's very own WGN News at 10.
On the medical watch tonight, just as the city is shutting down further, doctors in Chicago are calling on politicians to keep gyms open.
Medical reporter Dina Baer has the latest on their call to action.
The Chicago Medical Society wrote a strongly worded letter saying their health is at stake if gyms are not allowed greater hours of operation. Tonight, an infectious disease specialist gives the scientific evidence which, in his expertise, shows exercise is critical in the COVID-19 pandemic.
So the risk is actually less in the gym than it is in your office space as far as air turnover or even the supermarket.
Walking through the gym door is safe.
Our members, our employees are always masked at all times.
At the East Bank Club, masks, distancing, and cleaning are key. Flipping the tab to tell staff extra cleaning is necessary. After a good run, they can lift their hands to the many sanitizer dispensers.
Our members have begun to be more and more accustomed to what it takes to come to a safe environment to continue their mental and physical well-being.
They are well behind a barrier in group classes.
They have a plexiglass barrier between the instructor and the classroom.
Then there's this new piece of equipment.
It's an electrostatic fogging machine, so it attracts pollutants in the air and electrolyzes them and drops them to the ground. So it's sanitizing the air and the equipment.
The sprayer, used on aircraft as well, has a viricide to prevent the virus that causes COVID-19 from lingering. But doctors say they know now that's not the biggest threat.
But now we know a lot more about this virus than we did 6 months ago. The touching is not a huge aspect of it, even though we encourage washing your hands, using alcohol rinse. But really, it's droplet and airborne.
That's why airflow is so critical. Infectious disease experts consulted with gyms like the East Bank Club and the Fit Institute to advise on proper turnover.
The gym has actually increased their air turnover in each space to like 20 turnovers of air in an hour, which is far exceeds your supermarket or your office.
And for those stuck at home, eating and drinking and not exercising, that is the real danger.
Exercise clearly gets your endorphins moving, number one. It also improves your immunity.
And that means the ability to fight SARS-CoV-2. For frontline workers, it's been a nonstop effort to protect patients.
That's been one of the big problems with frontline workers we've noticed. Even within our own group of infectious disease doctors, the rate of burnout has increased exponentially as this has progressed because we've essentially been on the job all the time. And it's been hard on all of us. So getting in a set routine, so you work out in the morning or when you come home, and having that routine and having a way to get rid of that stress that you feel is important, as well as, mind, body, the mindfulness that you get.
That's why the plea for more gym access. Doctors say it is a matter of life and death.
I think it's really important that we get into a routine, work out, decrease our stress levels, and cope with this, because this is going to go on even with the vaccine, probably through the end of next year.
Why next year, when we just heard a vaccine is close? Healthcare workers will get the vaccine first, then high-risk patients, and then the general public. With distribution and refrigeration logistics, the sobering news is that will take well into next year. Back to you.